Okay, guys, we're going to talk a little bit about the different types of joints and different ways we classify those joints, and then the types of movement we see in joints. We've already talked about synovial joints in class, and probably by the time you're listening to this and watching this, we've talked about some specific synovial joints, but this is going to give you a little bit of a basis on the classifications of joints, including synovial joints, but there's other types as well, which you'll see. And then it's going to talk about the different types of movements that you will see with these different types of joints. Okay, so in general, the definition of a joint is where two bones come together, two or more. It doesn't have to be just two, but at least two. Okay, and this is known as the weakest part of the skeletal system. Okay, the main things that happen in joints are the joints are there to help provide shock absorption, obviously allow for movement, and the joints are there to hold the bones together. Without joints, we wouldn't be able to move. We'd be completely stiff, right? So the joints are very important. Even though they are the weakest part of the skeleton, they allow for movement. Okay, so there's a couple different ways that we can classify joints. The older system of classification is called the functional classification system. Okay, and what we see there is a few different types. The three names are synarthrosis, amphiarthrosis, and diarthrosis joints. Okay, and so diarthrosis are the joints that we typically think of when we think of joints. They have a lubricated joint cavity, and then synarthrosis is quite a bit different. That's when we talk about like this on the cranial bones. These bones coming together that are completely fused and there's no movement. So that's what it means, synarthrosis. That means without movement. And then there's amphiarthrosis joints, which allow for some movement, but not much movement compared to a diarthrosis joint. So synarthrosis joints are the joint between your tibia and your fibula here. And then we also see the joints between your vertebrae. Okay, for the most part, that system is not really used anymore. The new classification system is the structural classification system. That's the one that we typically use. And the criteria that we use to classify these different types of joints are based on the connective material binding the bones together, and then also the presence or absence of a joint cavity. So the three types of joints within this classification are the fibrous joints, cartilaginous joints, and synovial joints. And we've already talked quite a bit about synovial joints, but we'll talk here about the fibrous joints and the cartilaginous joints. Okay, so in fibrous joints, the bones are held together by fibrous connective tissue, mostly collagen fibers. There's no joint cavity, and this includes synarthrosis and amphiarthrosis types of joints, if you're looking at the other classification system. So there's three types of fibrous joints. One is the suture. The examples of these would be the way all the cranial and facial bones are held together. So the edges actually interlock. They're very short, thick fibers. Hold them together, and there's no movement at all. Okay, and then the syndesmosis joints, we have longer fibrous tissue with ligaments holding these together, but the mobility varies. There might be a little bit of movement, but definitely not a lot of movement. And then the last one is called the gomphosis joint. And this is pretty much a peg in a socket, periodontal ligaments holding these together. And this is typically talking about the teeth, how the teeth are held into the mandible and into the maxilla bones. Okay, so here's four examples of fibrous joints. Okay, and so if you had to guess, which one would you think was the syndesmosis joint? Okay, A is looking at the joints between cranial bones, so that's obviously not syndesmosis. That's going to be the suture type. Okay, and then the one here with the tooth, this is the gomphosis. And so then we have two examples of syndesmosis joints. One is the tibiofibular joint, the distal tibiofibular joint. This is the tibiofibular ligament. And so when somebody has what's called a high ankle sprain, this is actually what's ruptured here, what's sprained, this ligament here. So this joint doesn't move too much, but it does move a little bit. And then another example of a syndesmosis joint is this one here, where the radius and ulna are together in the forearm. Doesn't allow for much movement, but there is some movement. Okay, so B and D are the syndesmosis joints there. Okay, and then we have cartilaginous joints. So cartilaginous joints are literally held together by cartilage. There's no joint cavity, um, and there's just a slight amount of movement. So these are mostly considered amphiarthrosis joints. And then under this category, there's two types: synchondroses, which is where the bones are unified by hyaline cartilage. It's completely immovable, but most of this hyaline cartilage turns into bone. And then we have symphyses, and this is where bones are unified by fibrocartilage. Okay, so synchondrosis is hyaline cartilage unifying the joint. Symphyses are fibrocartilage unifying the joint. Synchondroses usually close, and symphyses are there for good. Okay, a couple examples of those. All right, so we've got a few different examples here, and so take a look at this and see if you can guess which ones would be synchondroses. Okay, so synchondroses again are places where we have hyaline cartilage connecting the bones together. Okay, so two examples. One here is A. So these joints between the sternum and the ribs. This is hyaline cartilage here, and that holds those joints together. This is an example of a synchondrosis that does not close with aging. C is an example of a growth plate. The hyaline cartilage in the growth plate. That, as you know, eventually closes. Okay, and then the two other examples are examples of symphysis type joints. Okay, so we have the pubic symphysis here. So this is fibrocartilage, and then we have intervertebral disc, which is also fibrocartilage. Okay, so two different types of cartilaginous joints. Okay, and then as we've been talking about in class, synovial joints. Okay, so this is the most common type of joint. There is a joint cavity, and it's lined with a synovial membrane that lubricates the joint. Okay, we talked a lot about that last Friday in class. And so there's different types of these joints, quite a few different types. Plane, hinge, pivot, condyloid, saddle, and ball and socket joints. So we'll look a little bit at each of these, and we'll look at the movements that they do. Okay, so now with the movements of the different types of synovial joints. So first is going to be the what's known as a plane joint, and what the type of movement that happens here is called non-axial movement. Okay, and so a few examples of those types of joints. One would be the intercarpal joints, all the little tiny joints between these strangely shaped carpal bones, as well as between the tarsal bones, and then also between the vertebrae with these what are called the facet joints. And I'm not going to spend too much time on each one of these, but you guys can go to your book, figure 8.11, and you'll find the same figure, and just make sure you understand these different movements. And next is the hinge joint, and this is a uniaxial joint, meaning that we have movement in one plane. Okay, and you can see here it has this kind of cylinder, and then this other shape here that fits the cylinder nicely. And a good example of this is what we would consider the elbow joint. Another example would be the interphalangeal joints, and that's what's shown here. Okay, and so this is really in the elbow. It's between the trochlear notch and the trochlea. Okay, and that allows for this kind of singular plane movement that you would get with flexion and extension of the elbow. Next, we have what's called a pivot joint, and with the pivot joint, we have a rotational type of movement where we have an axis and something rotates around it. So a good example of this is the joint between the atlas and the axis in the neck, and this is showing how that would rotate around. You can see it down here as well. And another good example of this joint is where the radius articulates with the capitulum, as well as with the radial notch on the ulna to allow for pronation and supination in the wrist. Okay, then now we have a condylar joint, and this allows for a biaxial movement, and so a good example of these are the metacarpal phalangeal joints. And so these are the joints between your metacarpals and then the proximal phalanges. Okay, so these are really what you think of when you think of your knuckles, and you'll notice with your knuckles you can do flexion extension with them, but you can also kind of wag your finger back and forth, like picture yourself like kind of saying like bad boy, wagging your finger back and forth. You can do that motion as well, so it's not just flexion extension, and you can also do this kind of circular motion with that too, and so that's different than just a typical saddle joint. And you see you also have these types of joints here between the radius and the scaphoid and the lunate. Okay, and then we have this another type of joint here called the saddle joint, and this type of joint allows for biaxial movement, means movement in two planes. So a good example of this would be the carpometacarpal joint of the thumb. Okay, so your thumb is able to do flexion extension as well as abduction and adduction, and that's so you have those two different planes of movement that occur at that joint, and this is showing those two planes right here. Okay, and then lastly we have ball and socket joint, and this is the multi-axial movement. It allows movement in 360 degrees of motion, depending on where you're at. But so you would find this in the shoulder and the hip, and so we've got lots of movement possibilities here. We have flexion, extension, abduction, adduction, circumduction is what's called when it's just kind of rotating around completely. Um, and this is obviously characterized by this ball and socket. Okay, and then lastly, I'll let you guys go ahead and do this clicker question on your own. Which of the following types of joints allow biaxial movement? And you can figure that out. All right, and that'll do it.